This is Miss Emily Duncan for our healthcare presentation interview. Okay, so what are some basic services that you offer students through the health fee?
I work for University Health Service. The health fee is $175 each semester, separate and optional during the summer, and that gives you unlimited office visits in our student clinic, University Health Service. So we have primary care, women's care, a nursing clinic, and behavioral health. So you can come to us as many times as you want to during the semester, and there's no additional cost for you. The health fee is already part of your tuition and fees. So you can come into us when you're feeling well and you just want to get a well physical exam, or you can come into us if you feel like you might have strep throat or the flu, or you fall down on your bike, something like that. We can help with all those things, as well as like our behavioral health clinic. If you have ADD or ADHD medications, we can do those maintenance appointments for you, and we have a full service pharmacy on our first floor.
Okay. Do you think there should be more options for students, such as covered medications, medical supply costs, and hospitalization funds?
Sure. So basically, as far as the health fee goes, we're just access to this one clinic. So I wouldn't necessarily think that we would add on those types of services to what we do, because for instance, if you needed emergency care after we're not open, we would want you to use this more in conjunction with a health insurance plan. So if you have health insurance in conjunction with what we have, that's really using it as it's designed to be. So if we did add some of those services, there would still be gaps for students, and so I want to make sure that they have all the coverage they need. So I think it's best that it's combined with the health insurance product.
So you think every student should get health care, no matter if it's from Obamacare or from a separate insurance?
Absolutely. I'm a big proponent of health insurance. I've been doing this work since 2005, and I've seen a lot of students that expected that nothing bad was going to happen, and they wound up with a very serious diagnosis, were in a serious accident, things like that. And without health insurance coverage to help you with those costs and mitigate that risk, you can have a life-changing amount of debt, and it might even influence the type of care that you decide to get ultimately. So yes, I'm a big proponent of health insurance.
Okay. Does your office offer any financial assistance with students who don't have insurance or having financial troubles?
So we don't have a financial assistance program. University Health Service is just one clinic. We are kind of based with UK ambulatory care, but we are also like financially separate from them because we are here specifically for students. So even though UK Healthcare has a financial assistance program for students that may need an x-ray and don't have any health insurance, things like that, they can help with that. As far as our services, most of them are free anyway. When you pay the health fee, you can come to us with no additional cost. So in most scenarios, you're going to come to us and there won't be any additional charges. But if you come to us and you need sutures like stitches, that's something that's beyond the health fee, but it's something we can perform. We can do that. We don't have any financial assistance for those services, but we do have the ability to give you some advice on how to find a health insurance product for you. In particular, people who don't have any health insurance right now and they don't feel like they have the financial resources to get it, the Affordable Care Act has expanded your access to health insurance plans that don't cost you any money. So we can also talk to you about that and the things that go into that kind of decision making, and even tell you what phone numbers and websites to go to get the ball rolling. So even though we don't have a financial assistance program, we try to help you through, keep you informed what's going to be free, what might have a cost, and then things that you might be able to do to get yourself some health insurance so you're fully protected.
Okay. What are some ways that you think to inform students about their healthcare needs and insurance policies and the basic information of having healthcare and what is important of it?
Sure. So health insurance is incredibly complicated. So if it's, especially if you're just new to the whole arena and you have a lot of basic questions, I would suggest coming in, making an appointment with me, and just saying, here's what I know, here's what I don't know, and then I can help you make a plan of finding something that's right for you. This UK does have a school-sponsored student health insurance plan. So basically what we do as a service is we have a health insurance plan that you can buy, and because students are generally healthy, the coverage is competitive and the benefits are competitive. So that's an option that you have. But we're also here to help you find some other plan. Our goal is for you to have the resources that you need. It's not that we sell you just the UK plan or anything like that. We're not salespeople. UK doesn't make any money on that. But as a service, we want to remove barriers to that. So I'd suggest that you come in, make an appointment if you're starting from square one. If you just want a little bit of a kickstart, UHS does have a website. There's also some good information on the UHS blog, and we specifically addressed before kind of what is the Affordable Care Act, how does it affect me, things like that as blog posts. And we also have really active Twitter and Facebook pages, so we touch on health insurance topics and also other things along the year.
Okay. Any other comments before we end?
Just that, we're really here to help you. We understand that it is complicated, and we are kind of, my favorite part of my job is having people leave my office as better informed consumers of healthcare, health insurance, whatever it would be. We want you to feel comfortable with what your options are and confident in how to use what resources are available to you.
All right. Thank you, Miss Emily.
Thank you.